Okay, so walk in, seeing is safe, wearing the correct PPE, which is gloves and glasses, and then also have the gown. We've also got our maternity kit ready as well. So we want to introduce ourselves to the patient and want to check to see whether she has a yellow card for antenatal, and also ask how far along she is and whether there are any known potential birthing complications. So, my name's Leah from New South Wales Ambulance, okay? So, I'm going to help you deliver this baby, okay? So, how far along are you?
I'm 39 weeks along.
Okay, and how far along are the contractions?
I'm having contractions every minute.
Every minute, okay. And they're quite strong?
Yes, they're strong.
Okay. So, obviously, then you want to start preparing the equipment. So, opening up the maternity pad, putting blueies down, that sort of thing, making sure that we've got the neonatal resus equipment on hand. If the husband's around, get him to heat up some towels, that sort of thing. So you want to ask the ecology questions. So your estimated due dates, obviously you said you're 39 weeks, so a week from today.
Yep.
Contractions are a minute apart, they're regular and they're frequent. Do you have any other children?
No.
No. So is this your first pregnancy?
Yes.
Okay. So obviously, first pregnancy, hasn't had any miscarriages, anything like that before. You haven't had any infections, C-sections, obviously, no. Do you know if you've got any complications with this pregnancy?
No.
No. Okay, so everything's all good. Do you know if your waters have broken?
Yes.
Okay, and
I think they have.
what did it feel like? Just like you've peed yourself a little bit?
Yes.
And what's the fluid like? Did it look clear?
Yes.
And then obviously you haven't had any sexually transmitted diseases, not on the pill, that sort of thing? No.
Right.
No. And do you currently using any medication, on any medication?
No.
Okay, so obviously when there's a contraction coming up, so I'm going to get you to only push when you are coming up to a contraction, so only if you have an urge to push, okay? So obviously checking as well, with the next contraction I am going to check to see if any crowning, and I'm going to explain to the patient what I'm doing. So next time you have a contraction, I'm going to just have a look down there, okay, and just see if I can see the top of the baby's head. Is that all right?
Yeah.
So making sure that you gain consent. Obviously, pain management, I'd probably suggest methoxyflurane if the mother would like it. But obviously, yeah, that's the only sort of medication I can offer. And whatever position she's comfortable in. So if she's supine, I might do the modified Sims position, which is putting the pillow underneath the left lateral side, just so there's no pressure on that inferior vena cava. Okay. So as the baby's head is delivering, I'm going to ask the woman to pant and breathe the baby out. So all I'm doing is resting my hands on either side of the baby's head and just allowing it to come out. Okay. So the spine should be away from the mother's spine, and as the baby comes out, just pant it out. And with the next contraction, so I'm going to place hand on either side of the baby's head and just slowly, as it comes out, gently guide the head out, and then okay, so the shoulders are out as well, so then I'm going to delivered the baby straight up to the mother's tummy. Just being careful. So obviously it's attached to the umbilical cord there. So making sure that there's skin-to-skin contact, don't touch the umbilical cord, and that I've done firm tactile stimulation. I'm going to cover the baby as well with some towels to make sure that it doesn't not get cold. With the umbilical cord, I'm going to wait until that stops pulsating, and once it stops pulsating, I'm then going to clamp at 10 centimeters away from the baby's abdomen. So that's 10 centimeters, and then 15 centimeters, so 5 centimeters from the 10 centimeter one, and then the third one is down near the mother's peritoneum, like that. So once I've clamped the cord, I'm going to record the birth time, perform an APGAR, and when the placenta is delivered, I'm going to place it in a suitable container and place the pad on the mother as well, and keep the mum warm and transport to hospital. Once I've cut the cord, or get the dad to cut the cord, and you may also, for expulsion of the placenta, give 10 units of oxytocin as well, and then transport to hospital.